This is Dr. Paul Steinke with Active Life Foot and Ankle in Southlake, Texas. And today we're doing an arthroplasty, but we're also doing what's called a hemiphalangectomy. So if we come in closer here, typically with a hammer toe, what's happening is the toe is curling, and you're gonna get a callus on the top of the toe here or here on what we call the proximal phalanx. So that's the bone here in the toe, so you get a callus there. Now, other places you can get them are between the toes. That's called a halomamali, caused by the bump here. But in this case, this patient has a callus on the outside of the toe on what's called the middle phalanx, or this little guy in the middle. So what we're doing today is we're doing a traditional arthroplasty, which I'll show you in a second what the traditional incision for that would look like. But today we're also doing this hemiphalangectomy. So we're doing a long incision and we're gonna split the bone in half. So hemi meaning half, phalangectomy, phalanx, and then ectomy meaning removal or surgical removal of the bone. So we've made our longitudinal incision. Again, usually we'll do a kind of angled one that when it closes will straighten the toe, but in her case, her issue is not the toe curling underneath, it's that she's getting the callus on the side. So we've exposed the top of the bone. This is actually what we call the extensor tendon. We're gonna go into this joint by releasing that tendon, which we will repair later. We'll remove the end of this long bone so the toe creates more flexibility and it doesn't rub against things. And then we're gonna take off the side of this, again, middle phalanx to remove the bone. So we've exposed the what we call proximal interphalangeal joint and proximal phalangeal head. Again, the end of the long bone at the base there. And what we're gonna do is we're gonna resect this joint. Now, usually this is the bone that caused problems, but again, we're removing this so that we just have more flexibility in that joint. So we'll be using a saw to cut the very end of that bone off, just like that. And that saw vibrates at a high rate of speed, and that's what makes the cut. So we can now expose the middle phalanx, whose total expanse is about from here to here. We're just splitting off the side of this bone. She doesn't need that part of the toe to function normally. It'll actually make the toe a little skinnier. So we're gonna cut that now. Pick up. And then we'll slowly tease that piece of bone out, and that is adjacent to where she gets her callus. So once this all is healed, that callus should just naturally disappear over time, and that will alleviate her painful symptoms. So the next step in this procedure is just closing the incisions, reapproximating the tendon we released, and she'll go home in a post-operative shoe with a dressing on. That will stay on the dressing just for 3 days, a check, and then sutures out at 10 to 14 days. And at that point, just at that 14-day mark, usually most patients are going back into a comfortable athletic shoe so that by 4 to 5 weeks, they're back to normal activity. Just some mild soreness and swelling that improves over time.